Cuomo, who joins us by phone fresh out of his meeting with the president, has been trying to do since the pandemic began. Governor, how did your meeting go, and what did you say to the president?
The meeting went well, and I think it was productive. The big issue was testing. As everybody knows, that's going to be the next step as we go forward. And how do we separate the responsibilities and the tasks on testing vis-a-vis a state and the federal government, and the acknowledgement that we all need to work together on this. It has to be a real partnership. And I think we had a very good conversation. A state has laboratories in the state. The state regulates the labs. The state should determine where tests are taken and how they're allocated. The tracing is a state function, but we need help from the federal government to make the supply chain work for the manufacturers on these reagents, on the test kits, et cetera. And we said that we would like to work together in New York State to take our current rate of testing. We do about 20,000 tests a day on average, and double that to go to 40,000. So it's a very aggressive goal. And we said that we would work together to meet that goal. So it was a very good conversation. I also spoke to the president about the need for the states to get funding. That's not in the current bill that the Congress is considering, but the states are in desperate shape, and everything's being left to the states to do the reopening, and then they don't provide any funding to the state government. So the president seemed very open and understanding of that, and said the next piece of legislation that passes, he's going to be open to that.
What was your approach with him? I mean, you obviously know that Nancy Pelosi has walked into that building and spoken truth to him and been attacked and ridiculed. Donald Trump has alternated between praising you, highlighting your compliments, and attacking you. How did you approach the meeting today with the president?
It's the same way I approach most of these situations. It's just honest, Nicole. It's just honest and open. And the president is communicative about his feelings, and I'm communicative about what I think. But look, I think for the president and for myself, this is not about anyone's emotions, about anyone else. I mean, who cares, right? What I feel, what he feels. We have a tremendous job that we have to get done, and put everything else aside and do the job. And that was the tone of the conversation, was very functional and effective.
Did the president say anything about his press coverage?
No. We talked about the issues. We had a broader conversation about the coronavirus, et cetera. He wanted to know what was working in New York, what was not working in New York, what our challenges ahead were, what we needed from the federal government, how we could see the state and the federal government working together. We talked about what the federal government did do during what I call phase one, when we were ramping up to try to develop hospital capacity. We took our state convention center, the so-called Javits Center, and the Army Corps of Engineers did a fantastic job putting in 2,500 beds. The president sent up a Navy ship, the Comfort, which was a hospital ship, which, by the way, was very good to have in case we had overflow. But I said, we don't really need the Comfort anymore. It did give us comfort, but we don't need it anymore. So if they need to deploy that somewhere else, they should take it.
What was your goal? I mean, were you invited to the White House, or did you ask to come down and talk to the president face-to-face?
I wanted to have a face-to-face conversation. This issue of testing and who does what on testing, we had to get this ironed out, so to speak. This is a very big issue. It's important for states that have a more difficult time reopening, like New York. It is how you educate yourself as you're making reopening decisions. And it's a frontier that we've never done before. This is all basically private sector labs and private sector manufacturers. And how do you get them to increase their volume tenfold when it's really not a government function at all? And how can the federal government help, and how can the states help? So that is the issue for the country right now, I think.
What is how do you see testing as a piece of bringing our state back? Do you see one test once a week? Do you see daily testing? Do you see a test to establish a baseline before you contemplate reopening any sector of life in New York State? Can you talk about how you see testing, why you think testing is this threshold issue for opening your state?
Well, I think initially it's a benchmark, right? Where are we on the? Are we on the increase? Are we on the plateau? Are we on the descent? The only way we track that now is really by the number of hospitalizations. That's the only hard data you have. We can extrapolate that.
And that's after people are already sick. I mean,
that's right.
Do you want to know how many asymptomatic people there are in your state, too?
Well, ideally you would. But the first piece of information is, as a benchmark, is the infection rate going up, or is it going down, or is it stable? And you don't find that out without testing.
Does the president share that? Does he seem to understand that? Because the way he talks at these briefings, it's, everyone that wants a test can have a test. He said in his red MAGA hat at the CDC a month ago. And then the latest take on testing from the president was, if they want to test, the governors have to test. I mean, does the president see testing the same way you do?
Well, I'm in New York that has one of the most intense situations in the country, if not the most intense situation. The sense I got from the president was that he was deferential to the needs of that state and the full spectrum of states, because some states are in a very different position. Look, some regions in my state are in a very different position, right? Even in New York, we have some counties where we have more cows than people, right? So density is not an issue.
Right.
So he was more understanding of different states having different problems and testing as a vehicle for those states that have the bigger issues.
Did you feel any sense that he wanted you to open faster than you think you're going to be able to? No, not that he communicated. He was inquisitive about what we were doing and what we thought and what we needed, but he never editorialized on what he thought was an appropriate timeline. What do you think in terms of just managing expectations about kids going back to school, about any of the sorts of soft openings that less densely populated regions have considered? What is your thinking right now on the timeline for looking at any of those steps?
I said to New Yorkers yesterday, don't get arrogant and don't get cocky. Just because we've shown that we can control the beast, which we have, the infection rate has reduced. We have a long way to go. And to make those decisions, you have to know that you're stabilizing the rate of infection, and that's where testing comes in, or you're reducing it. You have to fully accept new protocols, masks, social distancing, et cetera. And we need to rely on the data as we make these decisions. And again, that's why you go back to testing. Everything is closed. Schools are closed. Frankly, to reopen a school would be a major undertaking at this point. We are regionally coordinated in that we're acting in concert with other states, so we don't have people going back and forth between or among states, because different states have different rules. But status quo, let's plan reopening, plan a reimagined reopening where we learn the lessons of what we just went through. But unless we get data that says we're proceeding cautiously and safely, I think it has to be data-driven.
Governor, I'm curious. New York is my adopted state, and as you're talking, we're showing pictures of empty Times Square, of empty financial district, of our city shut down to protect our neighbors and our loved ones. Donald Trump lived in New York a lot longer than I did. Did he have any emotions that he expressed to you about seeing his hometown like this?
Oh, yes. He made exactly that point, Nicole. He spoke about how he's never seen the city this way. And I agree with him. I'm a born and bred New Yorker, more years than I care to remember, and I've never seen this under any circumstance. I mean, you can be in the middle of a tremendous snowstorm. You get more New Yorkers out than you get out now. And that's, I think, a factor that people forget. You know, it's one thing for government to say, okay, it's safe to go out. If people don't believe it's safe, they're not going to go. So the data and the testing works both ways. It can give people a sense of security. When they opened some of these other places, people didn't come out even though the government said you can come out. So it informs everyone.
Right. I'm sure you read the front page piece in today's New York Times with some questions about whether some of the things that make New York City, Broadway, the density, the subway, the restaurants, that some of those things may be threatened for a longer period of time. What's your take on when some of those things come back? Theaters, public transportation, restaurants, bars?
Well, look, it's anyone's guess, right? But if you don't have a therapeutic or a vaccine, I think you will see a significant lag in those areas, right? Because density is what created this issue. New York City is one of the most dense places on the globe. That's why you can't compare any other place to it. And density is a problem in this situation. And whatever we do or whatever government says, I just think people are going to be very wary before they walk into a Broadway theater or they get in a crowded subway car. They're going to want to know that there's a therapeutic, a vaccine, but some real safety measure before they subject themselves to a situation like that.
So my last question, Governor, I watch your briefings every day. We obviously cover you as a national figure. I think most New Yorkers would argue that our state is a national story, even when there's not a pandemic. But how are you, what is guiding you? I mean, are you looking to your team? Are you out talking to people? Are you surrounded by scientists? Do you have an open line to Dr. Fauci? I mean, what does your kitchen cabinet look like right now?
The kitchen cabinet is very broad right now because no one knows. There is no expert. There's no one person who's been through this. So I think the best advice is to talk to a number of people and then adapt it to your particular circumstance in New York. But my health commissioner, the health team, the statisticians, the data people who look at this, because a lot of this is trying to determine where we are and where it's going. Dr. Fauci certainly has tremendous experience, and he's been very generous with his time. So for me, it's been following the data and the science and trying to get ahead of this virus for the first time with the health officials. And then we've had an operational nightmare that we had to make sure the hospitals weren't overwhelmed, and we had to organize and manage the hospital system in the state like never before. And what people forget is it's not a government system. These are private hospitals that have never been managed by government. And now we're trying to get them to all coordinate. Go ahead.
No, go ahead. Sorry.
No, so there was both sides. It was an operational challenge, and then this unknown with the virus and the spread and the numbers.
You know, I wonder if you defended the hospital workers from the unfounded allegation that Donald Trump made a couple weeks back that they were doing something akin to hoarding or something worse with medical supplies. Has he backed off his suspicion of New York area hospital workers, or did that come up at all today?
That did not come up. That was more of a passing issue where the president made a comment that they were going out the back door. I don't know if it's a comment that people understand beyond the Northeast. I don't know how widespread that expression is, but it suggests that they may be somebody may be taking them wrongfully, going out the back door.
Right.
But it was a passing comment, and you can't rebut everything. So sometimes you just let it go in life.
Did you use the meeting to rebut anything that he's still saying? I mean, did you express any concern about his support for protesters over the weekend? I know there aren't any in our state yet, but did you raise any of that, or did you stay focused on other topics?
I stay focused on what we were there to talk about. And for me, the substantive agenda was testing, who does what, how do we get it up to scale? And somebody has to stand up for funding for the states. And the president's relying on governors, working with governors, which he is, and the vice president has been working with governors, and now we've determined that it's up to governors to reopen. They have a tremendous financial problem. And you can talk about small businesses and airlines. How about police? How about fire? How about teachers? And how about funding the reopening?
Someone said to me, it's like funding post 9/11 New York over and over and over and over again. Governor, thank you so much for getting on the phone and sharing what sounds like a very productive conversation on the subject of testing and funding for New York. And I hope we can keep a direct line to you to understand what's happening in the state of New York. Thank you, sir.